how we care for the dying, the weakest, the vulnerable members, is a good measure of a nation's greatness. We embark on this exercise with the primary intention to conceptualize a user-friendly tool to analyze a country's total environment for end-of-life care, and also for benchmarking purposes.
On the overall results, as we said, UK, Australia, New Zealand came in the top 3 places. The Western European countries, obviously having a longer history with end-of-life care and more developed healthcare systems, ranked in, say, the top 10, 12 slots. Developing countries, it's no surprise, came in at the bottom. The US ranked 9th overall, tied with Canada. The outlier there is the cost of end-of-life care in the US. In the US, for example, Medicare, with the Medicare coverage there, which is the social payment scheme for people over age 65, there is 6 months of coverage for end-of-life care in Medicare. You cannot go beyond that. Also, Medicare only pays for curative care or palliative care. So this started in 1983 when Medicare started paying for these activities. One had to make a binary decision about whether they wanted to be treated or whether they wanted to have hospice or palliative care. It's the only country that actually forces people to make that binary decision. Where the U.S. does very well is with the National Pension Scheme coverage. So with Medicare, everyone over age 65 does have access to those funds, although they have to make that trade-off decision. End-of-life care policy decision, accreditation of end-of-life care providers is very strong in the U.S., and the government attitude toward end-of-life care. Another strong area is the doctor-patient transparency. The U.S. ranked poorly compared to other industrialized developed countries, mostly because of the cost of end-of-life care. So on average, a patient pays $10,000, around $10,000 per week for end-of-life care. The next highest country in the index was about $3,800. There are a number of things the U.S. can do. The first is to look at the cost of end-of-life care. I think looking at the policies around end-of-life care and recognition of policies around end-of-life care is another issue. But really the cost side and even availability of end-of-life care services, palliative care services in the U.S. For people over age 65 is limited for when compared to other industrialized and developed countries.